Regenerative medicine is one of the fastest growing fields, with new papers published every single day. As a busy mom of two, I am guilty of not making the time to keep up with the research, and I think a lot of other veterinary professionals are in the same situation. My name is Dr. Adrienne Wright, and welcome to Sit, Stay, Learn, a short podcast where I review regenerative medicine uses in veterinary science. Each episode, I break down a paper, and then we spend like 10-15 minutes here just giving you the details you need to know to feel like you're staying up to date with the research. One of our customers emailed me and requested that I do a paper on PRP for dental uses. And this is something we've heard a lot about. A lot of customers talk about this, but I thought it would be perfect to share here. So I did select a recent publication titled Clinical Evaluation of Autologous PRP or platelet-rich plasma in the Treatment of Periodontitis in Small Breed Dogs. It was published in Animals in December of 2025. This study investigated the clinical effectiveness of PRP in the routine treatment of stage 2 to 3 periodontitis in small breed dogs. Oral cavity diseases are the most common pathological condition diagnosed in dogs, with periodontal disease being at the top. Some estimate that as much as 80% of dogs as young as 2 years old suffer from some form of periodontal disease, with many small breeds, including my own, being genetically predisposed. Periodontal disease in general is a chronic inflammatory state of the tissues that surround the tooth, fueled by bacteria under the dental plaque and the dog's own immune system. You hear inflammation, your mind should immediately go to PRP. I know mine does. But inflammation means destruction, and we see it in the joints, and we see it here with the destruction of support structures like the periodontal ligament and bone, and you couple that with the microbial activity, and you have just a real issue. The anaerobic bacteria present is also known for direct epithelial invasion, production of collagenases and proteases, which, remember, those break down things, endotoxin release, inhibition of neutrophil function, and stimulation of more pro-inflammatory cytokines that then cause, you guessed it, more inflammation. So all of this together causes the bacteria to evade the immune response, promotes that tissue destruction we talked about, and it continues to contribute to the progression of the disease. And once it progresses so far, you have deepened periodontal pockets, gingival recession, increased tooth mobility, furcation exposure, and eventually loss of that affected tooth or teeth. So standard therapy, we all know it. Plaque removal, polish the teeth, prophylactic means to help with the plaque and calculus accumulation, and then at-home dental care. And we talked about those small dogs accumulating plaque and calculus so quickly. So here you're looking at more frequent dentals to keep it at bay, but then some owners are wary of the general anesthesia, or maybe they just want alternative methods or methods that give better outcomes than a dental alone. So here enters platelet-rich plasma, or PRP. And like I said earlier, when you hear inflammation, you should immediately think PRP. But more than that, you heard microbial activity. And if you remember, we talked in one of the first episodes that PRP actually possesses antimicrobial properties, which, I'm still a little surprised by. But in PRP, you have strong anti-inflammatory properties from that 3 to 5 times concentration of platelets that gives bioactive platelet-derived growth factors like PDGF, FGF, VEGF, EGF, the list goes on and on. Now, here, this team is using PRP that's not been activated. So I want to clarify that. So in this study, they really are relying on the body to lyse or bust those platelets open to get the growth factors. I think the ideal scenario would be to use an activated PRP so that the platelets are already opened in the tube. You're minimizing the work that needs to be done in the mouth. And add to that the bactericidal, bacteriostatic effects from the antimicrobial peptides. You really have a therapeutic that's almost tailored to treating periodontal disease. Those antimicrobial properties are also so important for reducing infection risk at those sites of infections. We know the mouth is just disgusting. So this paper is not revolutionary. It actually validated findings from several older studies, some even in humans, and in some cases actually had better results, which I love. So the study started with 42 adult small breed dogs, 2 to 4 years of age, I think, weighing around 2 to 6 kilograms. They were fed only dry food, and they were not receiving any at-home dental care. I think that was a really good sample size here. Although a limited population, we'll concede there. But these dogs were coming in for routine dentals, and they were assigned to a treatment group, PRP, with dental or dental only, based on owner consent. I would have much preferred a randomized treatment group allocation here. I think doing it based on if the owners want to do it and assigning it to that treatment group is a little out of the ordinary. But all dogs did an exam and a standard dental cleaning. The control group stopped there. If they were in the PRP group, they got 0.1 mLs with a 30 gauge needle into the submucosal tissue beneath the gingiva and then into the periodontal pockets at the ligament attachment sites. Recheck was in 30 days. So the parameters they evaluated here were the stage of the disease, the gingival index, periodontal pocket depth, and horizontal bone loss. So let's look at the results because they really are quite beautiful. The short story is that the PRP group had significant improvement in every single outcome compared to the control group. But let's kind of look at the numbers a little bit. Periodontal pocket depth decreased by 1.70 millimeters in the PRP group compared to only 0.89 millimeters in the control group. That's almost 2 times. Horizontal bone loss decreased by 1.19 millimeters in the PRP group compared to only 0.94 millimeters in the controls. The stage of periodontitis reduced 1.5-fold. Gingival index decreased 3-fold with PRP and only 2-fold with the control. Periodontal pocket depth was reduced 2-fold compared to 1.5-fold with controls. Horizontal bone loss decreased more than 2-fold compared to baseline and 2.2-fold over the controls. No adverse events were reported. Slight swelling was observed at the injection sites on the first day, but no discomfort or inflammation was observed during follow-up visits, and that swelling did resolve 24 hours post-injection. I really think that could be due to the fact that they used whole platelets being injected, so we know that those can cause some pain, some irritation, and then obviously the body's trying to lyse those, so there's some activity going on. I really would like to see if that swelling persists when using an activated product. Let's see, they had hypersalivation observed in the first 2 to 3 hours, but no long-term symptoms. And there are reports of non-activated PRP being painful at the injection, and this really could, like I said, be the case here. So I'd love to see this repeated with activated. But one thing I did love about this paper is that they compared their results to other published results, and I love that transparency in a new publication. So here, they were able to demonstrate significant results within 30 days, whereas a 2023 paper by Chung et al. Only had significance at 56 days, but none at 28 days. This study confirmed PRP injections significantly reduced periodontal pocket depth compared to conventional cleaning that had already previously been published. In 2018, Amir et al. Published a human study where they had an average decrease of 0.72 millimeters at a month post-PRP. So this study in dogs observed over 2 times greater reduction, but Chung had also reported reductions of approximately 2 millimeters. Another thing, not only did they see soft tissue improvements, but also hard tissue. So the horizontal bone loss decreased by 2.12 millimeters compared to 1.4 millimeters observed by the Chung study at 56 days. Gingival index results showed a 3-fold reduction within 30 days. Chung had reported similar results, but they actually noticed this within 14 days. And I'm going to make another note here. The authors make the conclusion that Chung's group used activated PRP, and that's likely the cause of the rapid improvement because those growth factors are already bioavailable. I agree. We've talked about it. I think that using non-activated caused a lot of that swelling that they saw. And then I think it could also, take a little more time for the healing to happen because those growth factors aren't bioavailable from the moment they're injected like they would be with an activated PRP. I think that was a reasonable conclusion on their part. A couple of limits of the study: the age of the dogs and small breeds only. I would like to see this study repeated with a more diverse population and then to also have older animals. The authors do bring up that there is a report from 2021 that PRP effectiveness decreases with age and body weight, negatively correlates with platelet count, meaning lower platelet counts in heavier animals. Personally, I don't really think that this finding is relevant here. I don't necessarily agree with throwing it in. Maybe it's not that impactful. This finding is really yet to show itself in studies. I've yet to see a paper where weight had an impact on clinical outcome of PRP. And are they talking about weight as in 2 of the same breed, whereas the heavier one has less platelets? Or is my Frenchie, does she have more platelets than my coworker's Doodle? Either way, you're going to see biological variability from dog to dog, and that normal platelet range is quite large. I think it's like 150,000 to 400,000 per microliter. And in my opinion, this is the beauty of PRP, especially when activated. The body is already used to that baseline level. You're taking that baseline and concentrating it 3 to 5 times. This therapeutic concentration is unique to that animal. You're not taking a low platelet count animal, concentrating it, then administering it to an animal that's already at the top end of the range. Either way, would love to see this repeated. I think there's a lot of improvements. I think we've come a long way with PRP therapy, so maybe cats. I don't know. What are your thoughts? I would love to hear them. Please keep requesting copies of these papers and sending me papers to review. I want to help you feel like you know and understand the science that's being put out there. So for text versions of this episode, you can head to our blog. If you have questions on this episode or a paper you'd like for me to review, you can always email me at Adrienne@ardentanimalhealth.com. I hope you all have a wonderful week, and I'll see you next time.